In this video, we want to compare fluoroquinolones, a group of antibiotics, regarding the development of an adverse event called QT prolongation, which may lead to torsade point arrhythmias, which is a kind of abnormal heart rhythm, which may lead to sudden cardiac death. So we should be warned about this issue regarding the use of fluoroquinolones. Another main point to consider is that this adverse event is mostly developed at the presence of other conditions that may lead to the same issue, like hypokalemia, hypomagnesemia, or consumption of other medications with the same adverse event, like ondansetron, which is used for the treatment of nausea and vomiting. In this lecture, we want to sort fluoroquinolones regarding the development of this adverse event, QT prolongation, from the most to the least. Doxycycline has the highest risk of developing QT prolongation. After that, ciprofloxacin, ofloxacin, and levofloxacin are almost the same. So, moxifloxacin has the highest risk of developing QT prolongation. Ciprofloxacin, ofloxacin, and levofloxacin are almost the same. So, when using moxifloxacin, we should be warned about the development of these adverse events and limit other conditions that may lead to the same issue. Hope you enjoyed this video. Please like, subscribe, and share.